Many of these diseases are severe. In many cases, as we say, the child does not live beyond the age of 5. On the other end, we're now discovering more and more diseases that actually affect adults, older adults.
Some people say there are 250 rare diseases discoveries happen each year. What factors contribute to the rise?
Actually, technology. With the genetics, we're able now to actually get a diagnosis and to get it much more accurately and to get it much more rapidly. So we used to say there's maybe 6,000 rare diseases, and then we said 7,000, and now we're up to 10,000 because we're actually able to find people who we could not have found before.
What are the challenges in treating them?
The challenge, as we say, in identifying new rare diseases is that these are the ones that affect very, very few people. So you think about it, they affect 1 in a million people, 1 in 5 million people. So one, we don't know much about the disease. Even if we can identify the gene that might cause it, we really don't know what does it do. How does it cause this disease? And what we really don't know is we don't know anything about the life history of the disease. And so we don't really have the ability to actually find a treatment and be able to actually determine whether it's working for the patient. But even for much more common diseases, some of them that we have known the gene, like for muscular dystrophy, for many, many, many years, they're very complex diseases. So it is not easy to find a single treatment for the disease.
So for individuals with rare disease and for their family members, what are the challenges that they face?
I love the way you said it, because diseases don't just affect individuals, they affect the entire family. So if you think about it, we still think most rare diseases affect children because they are genetic, so you're born with it. Even if the symptoms don't show until much later, what we call late onset disease, you're born with the disease. Many of these diseases are severe. They can be life-threatening. In many cases, as we say, the child does not live beyond the age of 5. And that's very sad, but if you think about it, those first 5 years are actually very challenging. On the other end, we're now discovering more and more diseases that actually affect adults, older adults. This is really difficult because we don't really expect that adults will have these rare diseases. Oftentimes what looks like a rare disease, it gets dismissed because, okay, you're getting old. Of course you're going to have loss of memory. Of course you're going to have less functioning. Of course things are not going to be working. So it gets dismissed. This means that the disease is actually diagnosed much later when you might have been able to do something. By the time you get it, the person is quite symptomatic.
So what I heard is that rare disease, it's really important to diagnose it early. Please explain the significance of early diagnosis.
Now we have treatments, and the goal is to actually provide the treatment early on before the baby develops symptoms, because once you develop symptoms, you can't go backwards. You do not regain those functions. Even if you intervene now, you're only building on top of what the child has already developed. If we know early, we can actually intervene before the child actually becomes symptomatic.
That's true. I was really interested in how you said senior citizens also get rare diseases. So how do we even diagnose it for them?
What we're trying to do now are a couple of things. One is create more awareness, so that we actually, because it's training frontline physicians to actually be aware that there are such things as rare diseases for adults. We don't think about that. The second, though, is the exciting part is actually artificial intelligence. What we're able to do with AI now is we're actually able to provide information to a physician that says, here's a host of symptoms. If your patient is exhibiting this, can you go and check to see if, in fact, it might be an indication of a rare disease? We're doing a much better job of that. China actually has good medical records, and what you do is you use your AI program to evaluate all of these medical records, and it identifies people who might, in fact, have symptoms that would be indicators of a rare disease, but they're not diagnosed because most people don't get diagnosed. And you can now go back into that medical record, go back to the clinician and say, maybe this is a patient you should be following up on, and this patient may have this. If you aren't definitive, so we're doing it in many different ways. But artificial intelligence is really very helpful. And again, China can really be not only way ahead because you've got science, you've got a lot of patient records. You can actually develop these profiles that will let us into the future be able to early on identify patients.
So how do you regard China's response to rare diseases?
I say it quite honestly, China, like so many things, it learns rapidly, and then it moves very fast. And China has made so much progress in the genetics and genomics it has, so in the science of it, also in terms of doing gene therapies. There are more gene therapy clinical trials in China than anywhere else in the world. But the most impressive thing I've seen is the ability to do integrated diagnosis and care. Beijing, Shanghai, where you've got hospitals who are actually saying, okay, we're going to create a rare disease center, and we're going to screen and diagnose early, and then we're going to provide them with the access to the specialist treatment, but also some of the telehealth so that we can actually follow patients when they go back home.
Some people say like rare diseases are not just medical problems, but a global health and social issue. So
Right.
how do you...
I mean, what we say is that, a rare disease doesn't just affect a person medically, right? It also affects socially. So there's a challenge in terms of being able to continue to have the social interactions. It affects people economically, again, the loss of income or the inability to work. It affects from an educational point of view. In many cases, there's still a stigma attached to it. And most families that have rare diseases in the family also have some forms of depression, they have some forms of, emotional, challenges. So I think being able to take care of that as well, so that we're able to give people back a quality of life and the ability to appreciate